Hello, oral surgery colleagues, and welcome to the Oral Surgery Podcast. I am your host, Dr. Richard Moore, an oral surgeon based in the United Kingdom. The aim of this podcast channel is to discuss ways of improving practice in oral surgery, thereby creating a better journey and patient experience, and allowing us as clinicians to become better oral surgeons. All discussions on this channel are based on personal experience and opinions, which should be thought-provoking and supplemented with further research and evidence-based practice. Without further ado, let's jump into this podcast. Hello, podcasters, and welcome to yet another podcast. Today, I'm joined by a good friend and colleague, Christine Wanis, who's an oral surgeon in London, and we're going to have a chat about her career pathway and her interests in paediatric oral surgery. So, Christine, thanks for spending the time with me, and it'd be great if you could just tell our listeners about, how you've got to where you are now, and then we'll come on to life as a new specialist.
Hi, Richard. Thank you so much for inviting me to do this podcast. And can I just say as well, this is such a great idea. I love that you've sort of brought, oral surgery into the forefront
Thanks.
and brought people together. And it's nice to talk to colleagues about their interests. And, this is just a great idea. So I feel really privileged that you've asked me to come on here.
It's a pleasure.
So just a bit about me. So I have just recently finished or completed my specialty training in oral surgery, and you were part of that. So that I completed in Yorkshire. So I did a sort of 3-year rotational training program in Hull, Bradford, Leeds, and Sheffield. It was a great 3 years, but I've come back to my hometown, London, and now I'm a specialty dentist at Bart's Royal London Hospital.
And just before you got onto your specialty training, because there might be some people listening that, because it's so competitive to get into specialty training in oral surgery, as it is with any specialty really. But what was your run up from graduation into your kind of career pathway to specialty training? Because I think for a lot of people that sometimes is challenging, or what should I do next?
Yeah, absolutely. Well, it started in dental school. It was a situation where I started dentistry, I think, thinking I'm going to be a GDP. And this is what I always wanted. But as soon as I started, I was thinking, I'm not sure if GDP life is for me. And I think we started doing our oral surgery stint in 3rd year, and I just absolutely loved it from there. I just knew that this is what I was going to do. So
Okay.
immediately after I graduated, guys, shout out to my my tutors from Guys, because you know who you are. Really inspirational group over there, Guys and Kings, obviously. So I did my VT year, or what do you call it now, DFT.
Foundation training, yeah.
Foundation training, that's the one. So after that, I just went straight into dental core training. So I did 3 years. So I did DCT 1, 2, and 3, which is they were all based in oral maxillofacial units across the country. And then as I was applying, so at that point, so around sort of 3 years after graduation, I started applying for oral surgery. And like you said, super competitive. I was in the kind of initial application process where it was local applications, and I was sort of applying to different places, and every feedback I got was, you don't have enough publications, you don't have enough this, you don't have enough that. So I just thought, I just started getting on, doing research and doing as much as I could in terms of publications, posters, presentations. Really had to sort of try really hard, because academia is not my forte.
I think it's difficult depending what job you're in as well. I mean, if you're in a dental hospital job, or a job attached to a university hospital, it's sometimes a bit easier to get your foot in the door with some publications, isn't it? But if you're in a district general and it's busy, and sometimes you've got to find an opportunity, if it's a case report or
Yeah.
and a good audit. It's a really hard thing sometimes.
It is really hard, and it's all, self-directed. I didn't have much help
Mm,
to really sort of come up with the ideas and put in all the kind of the legwork, really. And yeah, it was challenging. It was challenging, but we got there in the end. So like I said, I was in the kind of interim phase where it was changing from local recruitment to national recruitment. So then I got into the first national recruitment interview process, which again challenging, but in a way fairer potentially, or more opportunities. And didn't get it the first time. Applied again, and I got it the second time. And although I was quite sad to move away from London, it was really the best thing for me. I think my training experience in Yorkshire has been absolutely fantastic. I think I got lucky. Obviously my training was affected by COVID, but I tried to make the most of it. And I was really lucky in the sense that I sort of had little opportunities because of COVID, where I was able to sort of have an even better experience and training, and I really got a lot out of it. And now I feel like I've got such a varied kind of experience because I've sort of I've worked in lots of different trusts and different teams, and I think there's value in that you see how people do things differently in
yeah.
different places, and you sort of you take other people's experience and specialisms, and you sort of make it your own. And I think that's where my experience has been quite good
I
overall.
think it's so easy to stay in the area or unit that you did your undergraduate training,
Yeah.
and many people do that, and that works for some people. But from a personal perspective, having worked all across the country before settling down, I think it's really important to have a taste of what other people do, what different units do. Everybody's got different techniques, and that old adage of "there's more than one way to skin a cat." Apologies to
Exactly.
cat lovers, but and it's true, and I think it's really good to get that experience, and then that enables you as a clinician to develop your techniques that work for you and are the best practice for your patient. So I think you may have been dragged away from the big smoke, but actually we would have loved to have kept you in Yorkshire. But never mind, we maybe in the future we'll lure you back. But I think
Yeah,
I think it is really good to move away, and things are very different out in different cities and different areas. So yeah, and the Yorkshire training program is fairly broad across different hospitals. So
yeah, yeah.
I'm glad that you enjoyed it.
I had such a good experience. I met some really amazing people who I'm in touch with, like yourself. And like I said, it's just not just it's not just a good experience in terms of clinically what I've seen and how people do, but also just experience of learning how to work in different teams, and um,
Mm,
learning how to deal with different personalities, and just like different ways that different departments work. So
yeah.
from a sort of a leadership or managerial perspective, you've got that kind of insight into how different people will be, and having that broader experience of just management, really management of
Yeah.
scenarios, management of people. That I think that was a valuable part of my training as well.
And it's interesting that you've picked that out of training as a valuable part, because a lot of people, because at the moment it is the 3-year program, feel that they don't get that leadership and management component, which is why a lot of people will intercalate and do the leadership fellow or apply for a leadership fellow. But obviously, when it changes to the 4-year program, that may change things. But I think some people come out of 3-year training and think, "Oh, I haven't really got enough leadership and management experience to carry, to be either a principal of a practice or a
Yeah.
consultant, to run a consultant-led service." But you obviously felt that you got that, which is good.
Yeah, I mean, I wouldn't say I'm, I wouldn't say I'm super experienced, but yeah, I see the value in doing, a fellowship in
Mm,
leadership. That I mean, it is a valuable kind of project, and I think it's absolutely fantastic that the new curriculum and the new training pathway has, elements of leadership and management in there, because it's so valuable, and this is what you're not really taught, and it's something that you have to almost kind of find yourself within your training pathway.
Yeah.
So yeah, it's obviously it's difficult to quantify leadership and management experience.
Yeah.
And I think what, when I was applying to consultant jobs, when they were available, that was the part that I think, because it's so difficult to quantify, it's difficult to kind of prove that you've got that experience.
Yeah.
That was the part that I sort of lacked, and so that's what I'm trying to do now. Getting on sort of courses and doing certificates and things like that in management. But I think as an all-rounded clinician, my training has really equipped me with so many skills that I didn't think I would get. I thought
Yeah.
I was going into oral surgery training, just so that I can get oral surgery training, just clinical training. But actually, I got so much more than that.
Oh, that's good. So, life as a new specialist,
Yeah,
and I guess there are many positives, I hope, but there will be some maybe not negatives, but challenges.
yeah,
And you've already touched on one with the lack of consultant posts. And again, not everybody does oral surgery training with a view to becoming an NHS consultant.
yeah,
But I think it's something that is everybody's conscious of the fact that there are few and far between consultant posts, and you've experienced that having come out of training. And it's not like perhaps some medical specialties where you're almost guaranteed a consultant post.
yeah.
So I think it'd be nice just to hear, maybe, shall we start with the challenges or the negatives, and not be so much glass half empty.
Yeah, yeah, sure. Yeah, I like to say challenges rather than negatives, just because, just because I feel like negatives is something that you can't overcome, but there's always a way.
Uh, Opportunities, I think, is the PC term, but
Yeah,
yeah, we'll go with challenges.
yeah, yeah. So yeah, like I said, it's no one really tells you what to expect after training, really. And this is what really kind of shook me a little bit when I finished my exam. I completed my oral surg last year, and I thought, okay, this is great. I'm a specialist, like officially, nearly. Um, and you can apply for consultant posts with an MRL Surge, and quantifiable training. Um, and at that point, I started signing up to all the websites. So you get the sort of the first look if there's any consultant jobs available. And at that time, actually, there was more jobs than I thought would be the case. I was quite shocked. There was a lot coming out at the time, that just after I finished my exam, really. And I thought, oh, this is fantastic, apply and everything like that. So I did. And like I said, the main thing that people were looking for was that post specialty training, or post CCST training, which, for listeners outside of the UK, it's a certification of specialty training. So yeah, this is what shocked me the most. And I just thought, well, if you can apply, and if you've completed your training, you've completed the exam, and you've done everything, you've done all this hard work just to finish, what more do they want? Actually, I think there is definite grounds to that, because you know y- as much as you've completed your training, you don't have that independent experience. And towards the end of my 3 years, my sort of consultants in Sheffield, they were, letting me do things more independently. So I was
Mm,
running my own general anesthetic lists. I did children's hospital lists and things like that on my own. So, so that is the experience I think that um, departments want. They want
yeah,
that post kind of being led with a consultant. They don't want you to be in theatre with a consultant. They want you to have independent lists. They want you to do things independently, set
yeah,
up services, things like that. And that's what I didn't have. I didn't have years of that. And so that's what I'm building now. That is what I'm doing now in my current job. So that's again something that no one really tells you. And in terms of challenges, it's always daunting and scary to do things on your own for the first time. And I think I think it's always a little bit scary, but most things are doable once you get in there, if that makes sense. So
Yeah.
once you start doing one list, you get into a sort of a rhythm, and okay, I can do this. Okay, this is feasible. Um, and yeah, I think there should be a level of that with incorporated within sort of at least the third year or whatever, the fourth year of training, because I think that's so crucial to you as a clinician, because you don't really make your own decisions if you're in theatre with a consultant. It's really the consultant's decision at the end of the day. If you're left to do a list on your own, that's great, because it just gives you, again, it's just leadership, isn't it? It's
Yeah.
leading the list on your own, and again, dealing with any challenges that might come up in the list. If there's bloods that haven't been done, or if a patient hasn't been prepped correctly or pre-assessed correctly, you have to know how to deal with that. And
Yeah.
just like simple things like knowing how to, if for example a patient's operation needs to be cancelled last minute because there's something wrong or whatever, you need to know how to, give not give bad news, but let the patient know, like that's quite challenging in itself, and that's something that I
Yeah.
learned again in those last few months of my training.
And I think certainly, I'm happy to, well, not happy, but I try and encourage our final year registrars
Yeah,
to, I'll be in the coffee room, but actually, if you want to manage this list, do the team brief, I'm there in the shadow.
yeah,
But like you've just said, it's not just about the clinical is, I'll come on to that as well, but certainly managing the patient or the family. And if there is a cancellation, at the end of the day, it's the named operator that needs to deal with that, and that's usually the consultant, yes. But actually, if you're the senior reg, so to speak, it's good experience for you to deal with that. But
yeah,
also, I think that the clinical side, because training is so streamlined nowadays, and I don't mean to harp on and sound like in my day, but having had that volume of experience clinically, also then with volume of clinical experience comes complications.
yeah,
And I think you can train many people to do procedure X, Y, and Z, but actually it's being able to deal with a
yeah,
complication appropriately and efficiently and safely,
yeah,
which sometimes you may not have come across in training or not towards the end of training. And then that that's what makes a good, well-rounded clinician, isn't it? And I think
yeah,
that's sometimes difficult.
yeah, absolutely. Again, you're sort of touching on my experience in the last 6 months of my training. I found out there was so many more. I was getting patients coming back with more and more complications. And I was thinking, God, am I doing something wrong? Like, I should be better now. I should be at my best. But actually, it's not because you're not doing your best. It's because you're treating more complex cases and you're doing
Yeah,
more complex procedures. So inevitably, you'll have more
yeah,
complications. Sorry. Um, and it's this that disheartened me initially. Like, in those like last 6 months, I was just thinking, gosh, like I've got like a black cloud over me. But actually, it is because you're doing more, or I was challenging myself to do more complex cases. My consultants were pushing me to do these cases, and they would be finding interesting patients or interesting
yeah,
clinical scenarios, and asking me, "Oh, do you want to do this on your list, or do you want to do this on the list we're doing together?"
yeah.
So
And that's good because it means that although you're almost independent, you know that there is that support there in the background if you need it. So that's the time to do complex work
yeah,
when you've got the support.
yeah, and this is actually what one of my consultants in Sheffield, he really did this a lot with me, and he said, and at the time I hated it because I was just like, God, so much pressure, like so much responsibility. But he was just like, but at the end of the day, you still know that you've got someone, so make the most of this time, because you're not going to get it again.
Yeah,
Um,
indeed.
so yeah, so this is so that's why I had a good experience in my training. I really have. So but yeah, so in terms of challenges, I would say, yeah, like you said, let's independently working, dealing with more complex cases, dealing with challenging patients, dealing with complications following surgery that you may not have dealt with before. Um, and like you said, there is a shortage. Let's face it. Let's be honest. There is a shortage of oral surgery posts nationally,
Mm,
comparatively to the number of trainees there are at the moment. And I agree, like you said, not everyone goes into oral surgery training wanting to be an NHS consultant. Um, but if you did, you really have to. It's another sort of stepping stone.
yeah,
I thought national recruitment was that's it. Once I get through that, it's fine. But it's still another there's still another stepping stone
yeah.
to get a consultant post. But yeah,
And also, you don't. It's not like you see specialist oral surgeon in primary care required very often in the back of the BDJ or NHS jobs. Unlike
yeah,
specialist orthodontist, specialist periodontist,
yeah.
it's not a common job that's advertised, is it?
No, it's not. And actually, I think a lot of situations, or a lot of people that I've talked to, they've come across opportunities just by sort of asking, actually.
Mm,
And I've had some sort of offers via colleagues of mine who have said, "Oh, actually, I'm just having a chat with my practice manager, or with the principal of the practice, and they're looking for an oral surgeon. Are you interested?" Sort of thing. So some things aren't quite out there on adverts and BDJ and all that. But there is a lot. There's a lot that you can kind of find in primary care, and this is another thing that I found that no one really teaches you. No one really teaches you in training how to work in primary care. It's all obviously secondary care based, and it's a different ballgame. It's definitely a
totally. Yeah.
different ballgame. And that is where the responsibility comes in. And I think that working in, mixing my week in primary care as well as secondary care has made me a better clinician in both aspects. So I've been better within secondary care because of my experience in primary care, and vice versa.
Yeah.
I think it's a good thing to have a mix of both. Um,
Definitely. I think the first time I ever did any primary care work, I felt so alone and isolated.
yeah,
And, whereas at work, I know so and so's next door if there's a problem
exactly.
or down the corridor. But in primary care, if you're on your own, it's a Saturday, there's just you, a nurse, and the receptionist, it is actually quite isolating.
Yeah,
So that's another area to develop. And again, is another challenge, really, that you don't glean from training.
yeah, yeah, absolutely. No one teaches you that. Again, it's something that you just have to do. Once you complete your training, and if it's something that you want to do, obviously. But I think it really does enhance your overall like clinical acumen because, like you said, just actually being on your own makes you think harder, and it makes you think, I need to get this patient out of pain, or I need to help this patient, and it's only
Yeah.
me that's here. Is this beyond my abilities? Do I need to refer this on? It's knowing yourself as well. It's knowing what you can and can't do. um, and sometimes, and it's you really need to know what you can achieve in practice. Do you have all the
Yeah.
equipment? Do you have all the the things that you need? And if you don't, it's knowing when to refer back to secondary care.
Yeah.
Um,
Even if you've got the clinical skill set.
Even if you've got the clinical skill set, yeah, are you in the right environment? Do
Exactly.
you have the
Yeah.
right assistants? Things like
Yeah.
that. So it just makes you think outside of the box, and it really has sort of opened my eyes to to just little things. Again, just working in a practice is so much different to
Mm.
working in a hospital. You can't just ask for something and it's there. You have to, it's sometimes not there, and you need to know what you have and what you don't have. So
Yeah. Yeah.
yeah, again, that's probably one aspect of training that, if I was in charge of it, I would want to have some element of primary care incorporated within training, because
Mm.
let's face it, most trainees will do some work. I mean, that it might not be their primary job, but they will do some work in primary care, and
Yeah.
there's so much scope for things to be done in primary care. Um,
Definitely,
mm,
definitely. And I think didn't wasn't there a survey a couple of years done looking at where people went after
yeah,
training?
yeah,
and I can't remember. I think it was Gavin that did that, wasn't it? Gavin
Yeah,
Wilson.
yeah,
And it would just be interesting to perhaps relook at that, or maybe redo that and see if things have changed. Because I think that was probably it's pre-COVID,
yeah,
just to see where the bulk of people have gone with their specialist training,
yeah,
and then probably that needs to be considered when they incorporate it into
yeah.
the training program.
Yeah, and it'll be interesting to see if there's a shift, not a shift, but
Mm,
like just more and more trainees are coming out and doing primary care work.
yeah.
Um, and if that is the case, yeah, it will be really good grounds for implementing some part or an aspect of training within primary care. It's
Mm,
something that I was discussing with one of my trainers actually in Hull in my ST1 year, my first year. I was saying, is there any scope to do this? And he was saying, well, like it's food for thought because, I do have colleagues who are interested in training
yeah.
in primary care. So I thought that was amazing that people want,
Yeah.
have that time to train in primary care, which is fantastic. But it's not
I
being
mean,
utilized.
we're talking about this, but when you think about other specialties like orthodontics,
Mm,
and the majority of those will go into primary care, well, or high proportion, and I could be wrong here. I don't think they've got an integrated primary care training
no,
pathway.
yeah,
So I guess we're not on our own, are we?
no, no.
But yeah, anyway,
We'll see what the
there we
future
go.
holds with that.
Yeah.
Yeah.
So, any other challenges? Many, I'm sure, but any other kind of key challenges that for discussion?
So I think just finding your feet really, and just again knowing also not how to knowing how to not be stagnant as well. Um,
Mm,
Always improving your skills because obviously in training you're always improving your skills. You're pushed to do things. You're pushed to do publications. You're pushed to do to go on courses, and you've got your educational aspect as well as your clinical aspect. And sometimes when you've finished your training, you might think, "Ah, like
that's it.
I don't have to do this stuff anymore." But actually, this is lifelong. Like
Yeah.
uh, again, that's the same thing with keeping up with a portfolio and continuing your sort of CPD and your
Mm,
professional development and all that. Obviously, there's stuff that's mandatory, but again, it's all self-directed. Pushing yourself to learn new talents and new skills is something that you have to do yourself. You have to find yourself, and it's again something that no one really tells you. It's like um, again with going into sort of implants and things like that. There's no sort of formal training really
mm,
within oral surgery. I mean, you do get experience, and I think within the curriculum it's part of it is part of the curriculum in that you should have some experience in implants and bone grafting. However, I wouldn't say that that's enough to go out and practice and start. I think you certainly need good mentorship. And again, I was very very lucky in my training. I had really good implant experience, but not
mm.
everyone has that. And especially those whose training experiences are primarily in district general hospitals where
Yeah, yeah,
limited. Um, but still, even with my sort of good experience within my training, I still don't feel 100% comfortable going out into practice and start placing implants.
yeah.
Although my consultants have said that's what you just got to get stuck in. It's I'm still not like I don't feel ready as such, but it's interesting hearing your chat with Farhan.
Oh,
um,
yeah,
that was a really good podcast actually because he's very encouraging. But yeah, a good mentor I think is key if
absolutely,
you're
absolutely, yeah,
interested in doing that. And I'm in the process of
yeah.
finding.
And that will, once you've found somebody, it will take off. You'll be
Yeah,
like a duck to water because you've got the skills, and you've also done quite a lot, and you'll be fairly confident. But still to this day, I texted a colleague the other night and said, "Oh, what do you think about this? What would you do in this situation?"
yeah,
Um, so we're always learning, and I think you should never not. You should always discuss cases with people. It's like working in an MDT; it's so beneficial,
Exactly.
and you should never think that. Well, I know it all, because we will never, till the day we die, know it all.
Absolutely.
Um,
Absolutely.
and two brains are better than one.
Absolutely. I think I think it's key to know that just because again, just because you've got the specialist title doesn't mean you're on
Mm,
your own. I mean, yes, like you said, in primary care, you might feel like you're on your own, but there's always colleagues, there's always friends you can ask.
yeah,
I ask you things. I ask my old consultants things, and eh, I you have to you have to know your limitations, and you have to know
yeah. I mean,
where you need
only.
help,
Uh,
or just a
uh,
second opinion.
Yeah, it was only the other night I text our little group about that coronectomy, and
Yeah, yeah,
you all gave me different answers, and I was
yeah,
like, "Well, this is what I've done," and then was like, "Oh, okay, that's fair enough." But it's definitely worthwhile discussing cases with people, and that's why the grand rounds is such a good thing as well, for
yeah,
people to share cases. So
yeah,
yeah,
absolutely.
it's interesting that, but definitely with the implants, I think you just need to just do it.
Exactly, and that is what I've been told as well. Just get stuck in, but I think
Easier said than done.
it is easier said than done. It's such a big leap, or it feels like a big leap at least.
Yeah,
But I'm sure once I'm in there, it
yeah,
might not feel like a big leap because I've done it before. But it's just different in primary care. You just
definitely. Yeah.
and also having said I've had good experience. I mean, I've only really used one implant system, so I don't know what others are like. So yeah, it's having that support system and support network around you,
Mm.
which is so important. It's really, really important to sort of have good relationships with your colleagues and, oral surgery colleagues, the people who are sort of doing similar things to you. Because, having that support is really important. And I was talking to Sammy, who was also on this podcast recently. He's sort of a good friend and mentor of mine, and we were talking about this. This is something again that no one really tells you in training. Like it kind of feels like you're slightly isolated after you've finished your training and you've got that title. It should it mean that you can do everything? No, it doesn't. And everything that you do after training is, you're building your skills, and that's like I said, it's lifelong.
Yeah, definitely.
Mm.
Okay, well let's move on to some more. Although you've touched on quite a lot of positives there, I think
Yeah.
you've blurred challenges and positives together. But positives,
Well, positives, I feel like I've got a bit more control over sort of my working week, mixing that the ability to mix primary and secondary care is unique, compared to medical jobs. For example,
yeah,
I think for me, I like to have different environments, and I like to work with different people. And I think if I was in one place for 5 days a week, I think I might lose it. I
yeah,
think I might
I'm
lose my mind. But
totally the same.
and that's not anything to do with other people. It's really me. Like I like to have different environments and different
Mm,
surroundings. But I think that's such a good thing in oral surgery. That people that obviously people might not appreciate during their training, and because it's primarily in secondary care. So mixing that has been really, really nice for me actually. I've really, really enjoyed that, and I'm really trying to find my feet there,
mm.
and find that good kind of sort of ratio. So yeah, I'm enjoying just having a little bit more control, and just feeling that I'm independent. It feels good
Yeah.
to be working independently, and exploring the limitations of what I can do, and just gradually chipping away at that, and getting more and more confident with more complex procedures.
Okay, excellent. And bizarrely, you've developed a subspecialty interest in oral surgery within paediatric oral surgery.
Yeah, yeah.
And where did that? Well, it didn't come from when I was working with you. Um,
You can see it. Yeah, no, I sort of stumbled upon this. So, again, once I finished my exam, my consultants were saying, what's your interest? Like, what do you want to go into? I was like, well, oral surgery. Like, that's my interest. Like, everything to do with oral surgery. But I never really thought about it until I was asked that question. And again, it wasn't the first thing I was thinking of. I was thinking, implants is my interest, and it is.
Mm,
Implants. I do definitely want to get into that soon. But I found myself being put on. I was in Sheffield and I was working at the Children's Hospital in Sheffield, and I was found myself being put on these general anaesthetic lists as an independent sort of surgeon, because I think we were a bit short staffed, and my consultants were quite confident in me that I was able to do these lists independently. So initially I was doing very, very simple sort of pediatric, like actual just exodontia,
mm.
and I just thought, oh god, this is too easy and stuff. But this is not what oral surgeons should be doing. Taking out deciduous teeth and sixes and things like that.
Yeah.
Actually, when you think about it, doing sort of 6 to 8 cases per session, um, there is so much scope. Plus a dental student or two, having to teach them and show them around and show them the ropes and see the kids and speak to the parents and make sure everything's set up and deal with the team and doing a team brief. There's a lot in there, and
Mm.
there's so much scope for making mistakes,
Yeah,
and
yeah, yeah.
that's again just starting off with simple things and just building things up. It is probably how I work, in my experience anyway. And then then I was put on sort of oral like children's oral surgery lists, so things like impacted canines and impacted
Mm.
teeth and exposed and bonding and supernumeraries and things like that. And I found it more challenging because I think that having having a sort of a joint case where it's orthodontic led treatment plans meant that you really had to think about what you're doing. So if a patient is listed for expose and bond of a impacted canine or surgical removal of an impacted canine where there's resorption of the two, you really have to read the notes to see, has this been discussed with the patient? Are they aware that there's severe resorption of the two? Is that in the plan? It's more challenging than your sort of bog standard dental-alveolar list where
Yeah.
there's impacted, you know, wisdom teeth, which comes with challenges. But I found pediatric oral surgery a bit more challenging. You're dealing with a little bit more,
Mm.
and things need to be sort of discussed like on a multidisciplinary clinic. And I've had certain, I was for a year and a bit in Sheffield. I was doing sort of joint clinics and things like that. And it's really interesting to see the kind of things that are referred by orthodontics, and whether that's in the hospital or outside orthodontics. Sometimes you have to challenge treatment plans, and sometimes you have to challenge why we're doing what we're doing. Um, more so than sort of like I said, your just sort of bog standard cases, wisdom teeth and things like that. So I just stumbled on it. I didn't think that was going to be my interest, but I stumbled on it, and now in the job that I'm doing, that's pretty much it's the core of what I'm doing within. Obviously, there's other aspects within my
Sure.
secondary care job, but it's the main reason that I've been appointed to this role, really.
Okay. And do you have an MDT set up for that with ortho?
Yeah, there is they call it a canine clinic, but
Oh,
it's
okay.
it's like a joint orthodontic oral
Yeah.
surgery
Yeah.
MDT.
Because I set one up was it just before COVID, I think?
Yeah,
And it's just horrendously busy. But
yeah,
it's brilliant because our registrars get to come to it. The ortho registrars can dip into it,
yeah.
and you're right. It's really interesting cases, and it's not just the child, is it? It's the parents as well.
Parents, yeah,
And you do see some weird and wonderful things that
yeah.
are very interesting, and then to be able to operate on them as well.
Yeah, and the Children's Hospital in Sheffield actually, there's a lot of cases. There's a lot of sort of rare
Mm,
childhood diseases and syndromes and
yeah.
that present at the Children's Hospital in Sheffield. and it's sort of a national referral centre. So you do see some weird and wonderful syndromes. So again, another good thing about my training, I saw some really, really interesting cases and
Yeah.
syndromes, and things that you've just really never. The books don't teach you this stuff.
No, no.
Yeah.
Oh, excellent.
So yeah, it's not something. It wasn't the first thing that I thought I'd be getting into. But it just happened. I just stumbled on it, and like I said, my current job is primarily based on that.
Okay, excellent. And has that then led on to this Project Tooth Fairy? Is that interlinked, or is that a separate? I'm not going to read into Project Tooth Fairy anything. I'm just going to let you tell me about it.
Yeah. So again, Product Tooth Fairy is something that I stumbled upon when this job was first sort of advertised. I looked into it, and again, there wasn't much information, but from the gist that I got from the information on the job description, it's basically an NHS England or NHS England initiative within London. So it's like a pan London thing,
Okay.
where obviously, of course, due to COVID, but also before COVID, there was already a backlog, and
Mm,
obviously COVID has made it so much worse. There's been such an increase in the waiting times for paediatric oral surgery and paediatric dentistry under general anaesthetic. And I mean, at Barts, I think that the waiting list before this initiative, it was about 2 years, and I just can't imagine,
no.
waiting 2 years for your child to have, carious deciduous teeth taken out. It's
Uh,
yeah,
I was just going to say, and also, there's no kind of opportunity for that to be done privately, is there? Or it's very limited.
no. I mean, I'm not aware. I don't know, but I'm not aware that there's a lot of these services done in the private sector.
Yeah.
So basically, this was on the job description. I applied for the job. It looked great, and obviously it was back in London, and it's where I wanted to be. So I applied for it, and it just when things just fall into place, it just fell into
Yeah.
place because
That's for me.
I had that, yeah, because I had that vast experience within Sheffield.
Mm,
And again, it within those sort of last sort of 8 months or so after my exam,
yeah.
where I was doing a lot more independent stuff, and they were saying, "Well, we need your experience," and I was thinking, "God, they need my experience. This is, yeah, I mean, this is just made for me then." And it's because I had that, doing these lists independently, and as well, not just doing things independently, but just knowing things like empowering the nursing team, the scrub team, and doing further training for our sort of dental nurses and things like that. And that is what they were
Mm,
looking for. Um, and I hope I can, I hope I'm doing that now. But it's something that I'm really excited about. It's we're basically it's a new sort of theatre setup within the dental hospital at the Royal London, and there's sort of three theatre suites that have been newly set up. And working in a dental hospital obviously is different to working in the main hospital or a children's
sure.
hospital where everything is there. Everything's, there's an ITU if there's any problems. There's,
Yeah.
there's an anaesthetist that's just filled with anaesthetists, like who are primarily pediatric anaesthetists. This is not the same. This is, you're working in a dental hospital, where yes, it's close to the main hospital, but it's not within the main hospital. And there's certain criteria, inclusion criteria and exclusion criteria, of
Sure.
course, but we are getting through the cases, and it's you feel like you're making a difference. You're making that difference in that you're just trying to cut down those waiting times.
Yeah.
And there's like I said, it's a pan London thing, and this hasn't quite started yet, and I think it's in the process of starting, where different hospitals within London are bringing their patients to be treated in the Royal London Dental Hospital.
Okay.
So that's starting new now. So I think it was just being set up. So this service has been set up since October 2021, and it's with every new service, there's always sort of downfalls and things, pitfalls that you need to sort of rectify and things that needs to be addressed and things like that. So I think initially we were just doing Bart's patients. Now I think we're starting to get, patients from Guy's and, the other London dental hospitals.
Yeah. Sounds like a really great initiative that, maybe it will go national. I don't know, but certainly it's a problem everywhere. It's a problem in our area. So London's not on its own with that.
No, absolutely, and I'm aware. I think there's something in sort of Midlands that's happening that's very similar
Okay.
as well. So I think this is inevitable. This is
Yeah.
inevitable.
Yeah.
COVID, it's COVID is still impacting waiting times. I mean, only recently we've had some GA lists being cancelled because shortage of staff and
Yeah.
sickness
Yeah.
and things like that. So I think this is going to be an ongoing problem.
Yeah. And as we record this kind of mid-March 2022, we're seeing that cases are on the rise again, aren't they?
Exactly,
And
exactly.
there's rumblings about what's going to happen. So
Yeah,
yeah, it's not going away.
yeah,
Anyway, on a more cheery note,
yeah.
you have a new initiative, which is your own initiative. Is that right?
Yeah, I mean, I'll definitely not take all the credit for it. It's a group.
Okay.
But yes, so I'm part of a newly set up charity, which is something I'm really excited about. It's so fulfilling, honestly. So my initial kind of interest in this kind of stuff is it started, I think it was 2018. I went on my first trip to Tanzania with a charity called Bridge to Aid, which is an absolutely fantastic charity. It's set up here in the UK, but they have obviously offices in Tanzania. And you just go out for 2 weeks basically on a dental volunteering program. You obviously get the training beforehand, and then you go out for 2 weeks, and you go to two kind of remote districts. Completely, these places are literally so derelict, so remote, no access to dentistry at all. And you go to these rooms. So basically, the kind of the offices in Tanzania, they set up these locations, and you go and you set up a chair, which is essentially a wooden chair, and you get your equipment and stuff. And obviously, the charity has their own equipment. And basically, for 2 weeks, you're just chipping out teeth. Essentially, we're just extracting teeth. And the great thing about the program was that we were training clinical officers who are basically like experienced uh, nurses, the
Okay.
equivalent of experienced nurses, or nurses with extended competencies, and we're teaching them how to take teeth out, basically. And
Right.
you go there, and people are piling outside, and they get their numbers, and you're treating them. So it's absolutely fantastic, making such an amazing difference. And you go
Yeah.
out there thinking, oh gosh, like we're doing such a good job, but actually, the effect on us was way more profound than we thought it would be. And it's so fulfilling. It's honestly one of the most like fulfilling things. And this is what I hated about COVID. I had like a trip planned in 2020, and obviously I hadn't been out there since. So yeah, it's been a bit annoying. But anyway, so this is what inspired me to set up this charity. And luckily I was part of a group of dentists. So we had a group of dentists within the UK. Who are all Egyptian, and we called ourselves the Coptic Dental Society. Coptic is just the old Egyptian language, and
Okay.
yeah, so I was part of this group, and we made a group of us. Then thought about this charity. So the charity is called Mobile Smiles. So the aim of the charity really is to set up these mobile dental units. So we've already purchased. We set ourselves up this idea first started in August 2020, and we've already raised over £50,000 and bought a dental van in Egypt.
Okay.
Yeah, and the plan is to again set out, volunteering programs for people
Okay.
across the world. Really, whoever wants to come. Really, you don't have to be Egyptian. And but yeah, so yeah, we're going to go out there this coming May, so in a couple of months, to do our first program. And yeah, it's really really exciting stuff. I'm really really looking forward to it.
And I assume it's a big problem in Egypt as well, is it? This,
Yeah,
the same kind of issues in Tanzania. It's
yeah,
not unique.
no, absolutely
And
not.
is there a website we can pop a link on, or
Yeah,
how do people
yeah.
get in touch with you for
Yep,
if they're
so our
interested?
website is www.copticdentalsociety.com,
Okay,
and there's a page on there for Mobile Smiles, and there's a link there for whoever wants to donate. But if anyone is interested, we also have a same thing. We have a Instagram page, Coptic Dental Society, and again, all the information that is on there. So
excellent.
yeah, really really exciting stuff coming up.
Oh, well, I'll put that
Mhm.
in the podcast link, and then people can look it up, and if they're enthusiastic, can drop you a message and get in touch.
Yeah, that would be awesome.
So it's we've covered a huge amount of ground in just under an hour on the first proper sunny day of the year, I think. So
Yeah.
I'm very grateful that you've gone indoors and plugged yourself in rather than sat in the sun. And it's been really interesting because obviously it was maybe 4 years ago when we first met,
Yeah, yeah.
when you were a baby registrar, and obviously
Really.
now, the magnet that London is, it's attracted you, and things are taking off, which is brilliant to hear. So I'm really, really pleased for you. And not
Thank you.
only with the kind of paid work, the charity work, which is very admirable as well. So
Yeah.
it sounds like things are going well, Christine.
Yeah, I hope so, hope so.
So onwards and upwards, and I'll put a link to your Instagram page as well in the podcast. But it's been brilliant chatting to you, so thanks very much.
Thank you so much for having me.
Pleasure. Thank you very much for listening to this podcast, and any resources will be linked in the description. Please do leave a review and rate the podcast on the iTunes Store. I hope you join me for the next episode. Goodbye for now.